Assalamu alaikum wa rahmatullahi wa barakatuh. In this session, we will start with oxygenation. In order to understand oxygenation, we have to understand the respiratory system. So we will review the respiratory system. Respiratory system, it is composed from the upper respiratory tract and the lower respiratory tract. So it starts from the nose, nostrils, then also it will go to the nasopharynx, the pharynx, then the then it will go to the larynx. From that we will start the lower respiratory tract, starting from the trachea, then bronchi. In the lower respiratory system, trachea, then the trachea, it is divided to the two parts entering the lung, which is the bronchi. The bronchi also, it is divided to bronchioles, which is a smaller pipes, smaller than the trachea, and it will divide then to bronchioles, and at the end of the bronchioles, each bronchioles, there is what we call it the alveoli. In the alveoli, the actual exchange of gases, it is occurred in the alveoli. So the alveolar sac, it is composed of a membrane from inside that has also a good blood supply. So the exchange of oxygen and carbon dioxide, it will happen there in the alveoli. So the oxygen, it will go from the alveolar membrane to the bloodstream in order to be distributed to the cells for oxygenation and process of production of energy. And the carbon dioxide, it will go out from the alveoli out to the outside air. There are many factors that influence or affect the respiratory function. In the factors that affect the respiratory function, the first one, which is the age. So the age is affecting the respiratory or the respiration by at the beginning or for new infants, you will find that the respiratory rate is high and it will reach up to 40 respiration or inspiration and expiration per minute, because the metabolism in children, in infants, sorry, is higher, and also in this case the oxygen and their lung is small, their heart is small. So in order to supply the body with the needed or oxygen demand, the respiratory and system, it has to go faster to supply that demand. By the age, when the respiratory rate, it will be decreased because the lungs will be the size of the lung, it will be larger, and the ability of extracting oxygen also, it will be more. So by that, it will be decreased. By in old age, the activity of the person, it will be less, because of that the demand for oxygen in this case, it will be low. Because of that, the respiration, it will go down to 12 per minute, 12 to 15 or 12 to 20 per minute. The environment also, according to the environment, you will have there are affection of respiration and oxygenation. depending on many factors. Like in hot weather, the energy or the oxygen consumption, it will be more. So because of that, due to the activities that we are doing, because of that, the respiratory rate, it will be increased. According also to the where we live. So if those who are living in high altitudes, in high mountains, the amount of oxygen or the concentration of oxygen in high altitude, it will be lower than at the sea level. Because of that, you will find that also it will affect their respiration and oxygenation. So those who are unfamiliar with this environment, when they are changing, when they want to go to another environment, they will have difficulty in breathing rather than those who are already living in that area. Also, our lifestyle, it will affect our need of oxygenation. So those who are doing strenuous activities, they are in need for more oxygen. Because of that, the respiratory system and the abilities of the lung, it will be working at the maximum level in order to supply them with a sufficient amount of oxygen. But those who are living or having a sedentary life, which is sometimes due to their work, like those who are working the whole day in the offices and they did not move, they are sitting, doing their services while they are sitting. In this case also it will affect their respiration and it will affect their oxygenation and the ability of the respiratory system. Health status also. According to the health status, our body, we cannot separate a system from other system. We cannot separate any organ from other organs of the body. So the function of all organs, they are going in a harmonious way and in a cooperation with each other. So any diseases or healthy problems, it will affect also respiration, especially the problems that affect the lung itself and the problems that affect the blood, the problems that affect the heart. All of those problems, healthy problems, it will affect the process of oxygenation, because the lungs are extracting the oxygen from the air and sending it to the blood. The blood is carrying it to the cells. So if the person is having anemia, in this case also the respiration and oxygenation, it will be affected. In heart disease, if the heart is not doing its functioning well, in this case also the process of pumping and distributing of blood to the circulation, to the body tissues, it will be affected. The blood vessels itself, if there is a defect in the blood vessels, if there is stenosis in one of the blood vessels, also the amount of oxygen which will reach to the certain organs that supplied by these blood vessels, it will be affected. Medication, the drugs that we are taking also, it will affect the respiration. So some of the drugs, it might be stimulant to the circulation, a stimulant to the respiration. Some of the drugs like narcotics, like analgesic, tranquilizer, all of those, it will decrease the muscular activities and it will decrease the body function. So it will lead to also decrease in the respiration and the ability of the respiratory system to extract oxygen. Stress, due to stress, in stress, this will increase the metabolism of the body. This will increase the chemical changes in our body. By that, it will need, there will be more need for the metabolism. The metabolism, it will need more oxygen, so the function of the cardiovascular system and respiration and oxygenation, it will be affected, and it need more oxygen and more work from the respiratory system. So those are the factors that affect the respiratory function. Then there is other factor, which is alteration in respiratory function. In alteration of respiratory function, if there is a change in the patency of the airway, if the airway is not enough patent, if it is not opened well, in this case there will be interference with the amount of air which will enter through those canals to the lungs in order to extract oxygen. So in the upper airway, starting from the nostril, those who are having adenoids, those who are having also nasal polyps, it will affect their respiration, and sometimes they might not be able to breathe properly from their nose. They might breathe also mouth. They might be a mouth breather due to that problem. It is severe constriction or severe affecting the or severe narrowing of the respiratory tract or the nostrils. So the patency, it might be upper and it might be lower. The cause طبعا in the lower, it might be bronchial spasm. Those who are having bronchial asthma, it will affect their respiration. So there are many causes that will interfere with the patency of the respiratory canal and interfere with the respiration. Signs, so that patency, it might be complete or partial obstruction. So the signs and symptoms, it depend upon the type of obstruction, the site of obstruction, and the extensivity of or seriousness of the narrowing or obstruction. So if it is in the bronchi, if there is stenosis of the bronchi or trachea, in this case you will hear the wheeze of respiration, especially in expiration. And also the respiratory rate, it will be high in this case, so he might have hyperpnea, and he might have tachypnea in this case due to that nerve. This is some of the retraction of the chest due to patency problem. We'll come to the cause and the signs and symptom. The causes for upper might be, and lower also, it might be foreign body, it might be the tank full due to relaxation of the tank, and the tank, it will go backward and closing the airway. It might be from a secretion, it might be from infection and inflammation. That infection and inflammation, it will lead to narrowing of the respiratory tract. The signs and symptoms, there will be abnormal breathing sound, and we will go then to the different type of breathing sound which is here there might be there, like also the client may suffer from snoring and extreme inspiration effort, so he will have difficulty in getting air in. So it is effort. Usually in normal cases we are not paying any effort for respiration, we are feeling relaxed, we are not concerned about our breathing, we are not counting our breathing, we did not feel it. This is normal. But in those cases we will there will be an effort in order to take the respiration. You will feel difficulty and to and being an effort to get the air in. Inability to cough or speak will be there. Alteration in respiration. Intercostal retraction. Intercostal retraction, it means that the muscular spasm, it will be there in the intercostal space. Because of that, you'll feel that that space in between the ribs, it will go inside. Alteration in respiratory function, movement of the air. So there is what we call it the eupnea. Eupnea, it means normal respiration. So in normal respiration we call it as eupnea, which has the normal characteristic of breathing, including the rate, which is in adult from 12 to 20, including the depth, which is moderate depth, including that there is no effort made in order to get the respiration. So the air is going smoothly in and out without an effort. This is, we call it the eupnea. The second one, which is tachypnea. Tachypnea, it means that there is increase in the respiratory rate. That increase in the respiratory rate depend upon the metabolism, it depend upon the activity, it depend upon many things. In case of also diseases, in case of high fever, in case of heart problem, all of those might lead to tachypnea. And in case of stress, bradypnea, it is a low breathing rate. So the rate of breathing, it will be less than normal. So it might be less than 12 in an adult. The fourth thing, which is apnea. Apnea, it means that there is no breathing. Hyperventilation. Hyperventilation, it means that there will be a deep breath, and also in this case it is the rate of breathing, it will be higher, and the breathing, it will be the depth of the breathing, it will be more. Hypoventilation, in this case the rate, it will be, it might be low, and also the depth, it will be low. This orthopnea. Orthopnea, it means that the client or the person will not be able to breathe normally in while he is lying. So he need to be in a sitting position or standing in order to breathe well. Dyspnea. Dyspnea, it means difficulty in breathing. Chinese stock respiration, which is a very deep to, it will change. There is a variation from a very deep to a very shallow with a short period of apnea. Pilots or clustered respiration, shallow breathing interrupted with a period of no breathing or apnea. Alteration in respiratory function. The alteration of respiratory function, which is alteration in diffusion, which is the transfer of air through the membrane of the alveolar sac to the blood. There is what we call it hypoxemia or hypoxia. Hypoxemia or hypoxia, it means that the level of oxygen in the blood, it will be less than normal. So the level of oxygen is less than normal. The signs and symptoms which appear on the patient in this case, it is cyanosis, flaring of the nostril. So the nostril, you'll feel that it is widening of the opening of the nostrils or the nasal canals. Tired and stressness, so the patient will feel tired easily, fatigability, and he will be restless due to low level of oxygen which is going to the brain. Often he will be in a sitting position, because in sitting position it will relieve the pressure on the diaphragm, so it will give space for the lung to expand better. Fatigue and also lethargic. Rapid shallow respiration and dyspnea, which is difficulty in breathing. In chronic cases, you will find that clapping finger and toes will be there, especially in case which is caused by cardiac disease and heart failure. So you will find that clapping of finger, it will be there. Rapid pulse will be there, and intercostal retraction. Alteration in respiratory function. In the alteration of respiratory function, also we have the alteration of transport of oxygen. The alteration of transport of oxygen, you know that the oxygen, when it is there is exchange of gases, so the oxygen, it will go to the capillary blood supply to in the lung, which is around the alveoli, and it will go to the blood stream to the heart. From the heart, it will be pumped to the circulation to all body tissues. So if there is any defect in the circulation or in the heart, in this case it will affect the transport of oxygen to the tissue. So in this case, the body tissue will not be able to utilize its demand from oxygen. Abnormal breathing sound. In abnormal breathing sound, there are many breathing sound which is abnormally. Usually the breathing sound we will we will not feel it mostly, but in case of abnormal breathing sound, the client might have stridors. Also, he might have stertorous respiration. Wheezing will be there, especially due to narrowing of the bronchioles and bronchial and the bronchi. Bubbling, which is due to passing of air through the some fluid in the lungs in case of pulmonary edema. So secretion will be there, and coughing. So all of those, the secretion and interfere with the breathing sound and lead to those change in sound. Hemoptysis might be there also in case of secretion. So presence of blood in the sputum, it is called hemoptysis. It is in case of severe infection, it might be happen there. A productive cough. A productive cough, it means that the patient or the person is coughing, and when excretion will be there or secretion will be there with the cough. We call it wet cough sometimes. Non-productive cough, it is a dry, harsh coughing without secretion. So then we will come to the assessment of respiration or oxygenation. We will go to the history of the client. We have to take the current and past respiratory and cardiovascular problems. So we have to ask the client about if he has any previous history of respiratory disease or cardiac problem that might affect his respiration. Also, lifestyle, what is the usual activity that he is doing. Also, so it include the nutrition, it would include the activity that he is doing, what is his work and profession. All of those, it will affect the respiration. A presence of cough or sputum and pain. If sputum is there, also we have to assess and to ask about the color of the sputum, the amount of sputum, when the client is having the sputum, is it for the whole day, is it morning time or at night. The pain also, what's when pain is there, we have to know the type of pain, the location of pain, where is it, in which side of the body, is it all over the chest, when he feel the pain, is it during inspiration or expiration, or is it continuous. Also, the extensity of the pain, is it severe pain, we can grade it from, we can ask the patient to grade it from 1 to 10. The 0 is no pain, and the 10, it is a very extensive pain that the patient cannot tolerate. Medication, what kind of medication that the client is taking, and is that medication affecting respiration or not. The presence of risk factor for impaired oxygenation, like if the client is smoker, if he is working in a dusty area, so all of those factors, it will lead to impairment of oxygenation. Current and past respiratory and cardiovascular, as we said, life is then we will go to physical assessment or physical examination. In physical examination, we have to do inspection. For inspection, as you took previously in health assessment, we will start with the inspection of the chest. We have to see the symmetry. We have to inspect also when we the chest movement and the symmetry of just the chest movement. We inspect also the rhythm of breathing, and also we will we can see from the any abnormality within the chest. We can see also if there is a retraction of the intercostal muscle. All of those things we have to inspect them while we are assessing the respiration. Then palpation, we have to see if there is any tenderness and any place of the chest, starting from front and back and lateral side. Percussion also to see if there is any the resonance sound and the dullness through or over the chest, and to see if there is any site of consolidation or accumulation of fluid, and this will give a change in the sound of the percussion. Auscultation to see the normal, to differentiate between normal and abnormal chest sound and breathing sound. Normal, when you will find that bronchial and vascular sound will be there. Abnormal, you might hear the crackles, you might hear the wheeze. So there are many breathing sound, abnormal breathing sound that you might hear during auscultation. Diagnostic study for respiration or respiratory system, we can take sputum specimen. It can be taken for normal study or analysis, and it can be taken for culture and sensitivity. We can take throat swab for culture. Also, we can take blood specimen for to see if the client is having anemia or any other problems that will affect the respiration. Pulmonary function test also, we can do the pulmonary function test as a diagnostic study. Capacity of the lung capacity and the vital capacity and all of those things. The nursing diagnosis for the respiratory system, here we have ineffective airway clearance. So when there is any effect in the passage of the air through the airway. Ineffective breathing patterns, when there is a change in the pattern of breathing and mood of breathing. Impaired gas exchanges, which is here in the alveoli between the which is the external inspiration and internal inspiration. The external respiration, you know that it is the exchange of gases between the alveoli or and the external air inside the lung, and the internal respiration, which is exchange in between the blood and the blood tissues, or between the cells. So after transferring the oxygen to the cells. Activity intolerance, the patient ability or the person ability to tolerate activity. In this case, when the client is having difficulty in breathing or low oxygen level, he will not be able to tolerate activity or doing activity well. Alteration in tissue perfusion, change in the exchange of gases. So then we will go to the planning. The planning, it is, we have to facilitating pulmonary ventilation. So in case of airway, anything that interfere with the airway, we have to facilitate the ventilation, maintain the diffusion of gases to normal level, maintaining patent airway, clear airway and patent airway, and promote the transport of gases. The facilitating pulmonary ventilation and oxygenation, we said that we have to have patent airway, we have to keep the airway open by positioning of the client also. So position of the client to have a clear airway, sometime in case of difficulty in breathing, which result in the tongue when the tongue is relaxed and going backward, so we have to put the client at flat position, and we have to tilt his head backward and lift his chin to open the airway. When there is difficulty in breathing, we have to put the client in semi-sitting position or semi-sitting or sitting position in order to decrease the pressure of the abdominal organs on the diaphragm, and by that it will help in full expansion. Deep breathing and coughing exercise. So we have to help the client to maintain and to increase the capability of the lung to exchange air by increasing the capacity of the lungs through a deep breathing and coughing exercise that we have to teach it to the client in order to breathe well. Adequate hydration. Adequate amount of fluid should be given, especially in case of if there is excretion, if there is infection, we have to give adequate amount of fluid in order to help in clearing of the infection with the drugs. Suctioning if it is needed. So if the airway, if there is excretion in the airway, we have to do suctioning for it. Suitable activities which the client can tolerate. Ambulation and exercises. Ambulation and exercises also, it will help the client to increase his capability to adapt to loss of oxygen. Medication also, medication that can help in the oxygenation, like broncho dilator in case of problem with the patency of the airway. So that medication, it will help in dilation of the bronchi and help in the passing for opening of the airway for air to move freely. Then incentive spirometry. So in this case we can check the respiratory and the amount of air that enters the lungs. Also percussion and vibration and postural drainage. Also those procedures can help in the getting rid of the excretion which is there in the lung. Mucus clearance device also can be used. Oxygen therapy can be used to maintain adequate amount of oxygen to the lung. And immobile patient or patient with abdominal or chest pain or patient with a shallow respiration cause limitation of chest expansion, lead to stasis and pooling of secretion and lead to infection. So in this case we have to clear the excretion from their lung, and we can do for them postural drainage, and we can help them to get rid of that secretion. Incentive respiratory or spirometer. This kind of spirometer that will show what will help us to measure the lung capacity by the client will blow air, will take breathing and then blow the air through that machine. So it will show the amount of or the lung capacity. Positioning patient for maximum expansion, the semi-fowler position and fowler position, and turning from side to side will allow a maximum chest expansion, especially when the client is bedridden. So in this case we have to change his position. By that we prevent stasis of fluid or secretion in their lung, and we will help them to expel this out. And also when we put him in a sitting position or a semi-fowler position, which is a semi-sitting position, it is in 45 degree, so he will be lying in bed with a back support and at a level of 45 degree. Orthopedic position, the abdominal organs usually, as we said, are not pressuring in the diaphragm here when orthopedic position, and also can press the lower part of the chest against a table for the exhalation. So in this case the patient will be in sitting position and supporting his body and putting his hand over a table, leaning toward that table. That will help also in the breathing. Also ambulation and pain relief. We have to give pain relief if the client is having pain during inspiration or expiration or during breathing, and we have to increase mobility. By increasing mobility it will help to maintain the oxygen or the breathing and oxygen exchange, and also it will give as an exercise, it will help the respiratory system to regain its ability. So this is the Fowler position. In Fowler position the client is lying in bed and his back is 45 degree with the bed. The orthopedic position or orthopedic position, in this case the patient is sitting and he is leaning forward over bed table that will support him. Then for helping the client with difficulty in breathing, we are using the simple mask or simple face mask to give an oxygen. So this is the simple face mask. So it is connected with a source of oxygen, either a cylinder or a wall outlet. There are some holes here for exhalation port, and also metal pieces that will help to fix the mask over the nose. The other method of giving oxygen, we are giving oxygen through nasal cannula or bronchs. There is partial non-breather and rebreather mask. So there are other type of mask, and each type of mask it will give a different concentration of oxygen, and it has its own use. We'll discuss that. And Venturi mask, it has a valve that can be adjustable to adjust the concentration of